Welcome to the Healers Café, the number one show for medical practitioners and holistic healers to have heart to heart conversations about their day to day lives while sharing their expertise for improving your health and wellness. So, welcome to the Healers Cafe. And today I have Dr. Marina Stratsak-Suri. I hope I didn't completely butcher that.
Pretty close.
Straszak-Suri, but I'm sure you could say it better. And well, you've had you're an experienced OB/GYN educator and 35 years of experience in women's health and fertility. And then you've also taken a not mixed approach, a holistic, complementary approach of looking at the paradigm, conventional paradigm, with also more holistic paradigms, but evidence-based holistic approaches. It was functional medicine, so
Mhm.
so you're looking at the blood work and seeing, but a bigger blood work and more blood work than
Mhm.
typically we assess in conventional medicine to see if the thyroid, for example, is off. I don't know how it is in the States everywhere, but we're very limited in what we can order as medical doctors. You have to explain why you would want a bigger profile in order to get a bigger picture of the person. So often, you have to really ask for more and you have to justify it because they only pay for certain amounts of things and the rest you pay out of pocket. But they don't like that because they think it should all be included. So anyway, it's very mixed and very difficult for pregnant women over here. But so why don't we start with just welcome, and then why don't you share a bit your experience and what an educator, what your role is, and what you've been
Sure,
educating on.
sure. Well, I'm a conventionally trained OBGYN in Ottawa, Canada. I used to practice everything, including delivering babies and doing surgery. But at this point in my career, I just do office gynecology. I'm a generalist, which means I do anything in women's health, whether it be fertility or contraception or sexual dysfunction or abnormal pap smears. Basically whatever comes my way, I will deal with. And I got interested in functional medicine, which is more of a roots cause approach medicine, about 20 years ago when Mark Hyman's first book came out called, I believe, Ultra Wellness.
Yeah.
And when I read that book, it really opened my eyes to another way of looking at medicine, very much as to, not just making a diagnosis and treating a condition, but asking the question why. Why is this happening? What are the potential causes? And functional medicine really looks at everything from in lifestyle, from what you eat, how much you sleep, how much stress you're under, but also your genetics. And it's a very holistic approach. It doesn't treat, the pelvis is one part of the body that's not attached to anything else, but everything. And that really opened my eyes in treating, in treating my patients, but also in my own health and, health problems I was dealing with. I was very tempted to maybe do just functional medicine, but at the time that was a scary proposition because, first of all, it wasn't well known here. And second of all, people in Canada are very used to having everything paid for. And in
Right.
functional medicine, you do need to order a lot of tests, extra testing. Often that testing is only available in the United States. And it's quite expensive in terms of time because you have to spend a lot of time finding out about a patient's history. So I don't call myself a functional medicine doctor. I made the decision to stay within the system in which I work, but I just brought aspects of it
Right.
into how I deal with patients, how I explain things, to get them to read, to get more knowledge about things, and to understand their conditions better.
Mhm.
But I still practice pretty conventional medicine.
Right. I mean, it's really it's the woman who prepares her body anyways. So it's like it must be a field where there's a little bit more connection to your body than most other fields, right? Like you're suddenly needing to care for another human being if you're, pregnant. So suddenly you start thinking, oh, is it this I should be eating or that? Or it's
Mhm.
really an educated time, where women tend to look at everything or all possibilities, or if they have infertility issues, at what are the causes, like where did this begin, is it you know
Exactly.
is it me, or is it my partner, is it the food we're eating or the plastics we're drinking or
Exactly. But those questions aren't usually the ones that are asked. It's usually, are my tubes open? Is my husband's sperm count okay? And I
Mm,
think you need to go well beyond that because, the
true.
food we eat is really important
Yeah,
and the plastics we consume are very important.
yeah. Well, I think I can't remember what this was, quite a while ago, at least 20 years ago. I went to a conference and they were saying male testosterone was going way down and the sperm count was like of a 70-year-old in a 35-year-old, and I'm like, oh my God, that was then. I can't imagine.
Yeah. In two
Oh,
generations, sperm counts have gone down by more than 50%, and they're
wow.
continuing to decrease at a
Yeah,
very rapid rate.
yeah,
It's very scary.
yeah. No, that's definitely an issue for creation and for human beings, right? I
Hmm.
think that's going to have to come from somewhere.
Exactly.
So what is the most common issue that you see, that couples or women come in, for, in your experience?
Are you talking about infertility patients or in general in my practice?
In general, in your practice, yeah.
So, because we are seeing a lot more obesity and metabolic disease and
Mhm.
insulin resistance and diabetes, we're also seeing more polycystic ovarian syndrome, which is a related condition where women are not ovulating regularly and they're having more trouble getting pregnant. And the other thing that I see a lot more of is endometriosis, which is a
Mhm.
condition causing painful periods and fertility problems.
Right.
And both those things I used to see in my practice a lot, but now it seems like I'm seeing so much more of both of them. And
Mm,
I'm convinced that the chemicals in the environment play a role in both of those things.
mhm.
And those are both fertility issues.
Right.
And
Yeah.
lifestyle plays a role in both of those things, in treating those things. Only I don't think in conventional medicine they do look at lifestyle at all. They
No.
look for drugs or surgery, which are pretty limited when it comes to fertility because most of the drugs they use for both of those conditions prevent you from getting pregnant at the time you're using them. So it's
Right.
not very helpful for the young woman who wants to get pregnant.
Oh, no, 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 definitely not. Sorry, it reminds me of a terrible story, but I just have to share it. It was actually when I was in practice, which I'm currently not in practice, but so this was about 35 years ago, and it was in my first year of practice, and I've practiced about 30 years. I had a woman come in, absolutely eager to get pregnant, to learn all the right things to eat, what to do, what not to do, everything. And I was working in Nova Scotia at the time. And in her, the medical file, where she fills out her conditions and this and that. And I have at the time it was about 4 pages, to sort of know the history. She had put hysterectomy. And I had to go through the form, and she's like 24, and it just broke my heart. She did not know what that was. What she said is that it would help her period so that it would stop being so painful, and that she would eventually not have to have one. But that's the lack of education, the informed consent that went
Wow.
missing. That was
Wow.
huge. That yeah, that got me very upset first year
Very
of practice.
shocking.
It's
Yeah.
very shocking, so yeah, I think what do you see that is not being, told, or that you feel pe women need to know, whether they're told or not? It depends what you read. And what's kind of things that, if you could tell women, like two, three things, please read about this or know about that.
I think I'm seeing a lot more women who are delaying pregnancy for many reasons, whether it's their work or not
Mm,
finding a partner or finances. And they seem to have this idea that freezing their eggs is just going to solve everything. First of all, I
mm,
want them to know that the quality of the eggs they freeze is very important. So, just freezing any old egg is not going to do the trick. You want to freeze a high quality egg. And the way you make a high quality egg is by being healthy, by, having the best diet possible, sleeping as much as you need to, exercising, dealing with stress, avoiding chemicals, and then you get a high quality egg. And, so if you're planning to freeze your eggs, take the time to improve your health before you do that.
mm.
That's
Yeah.
one important thing.
Hmm.
The other important thing that I say throughout my book is don't take your fertility for granted, especially, when you're young, you have painful periods, you go to see the doctor and they put you on the birth control pill so you can just forget about your periods for the next 10
Right.
years. Don't think that that's going to solve your problem in the end, because of what the doctors often forget to say is you may have a problem getting pregnant in the future, and that should be dealt with sooner than later,
Mm.
rather than just
Yeah.
forget about it. And
Yeah, no, yeah, it seems like they would have to be related. Eventually, you have to get to the cause of this, right? So,
exactly,
yeah.
exactly. But people sort of tend to think of the birth control pill as a cure, and it's not a cure.
Hmm.
It's just a management.
Hmm.
It treats the symptoms, but it doesn't solve the problem.
Yeah. Yeah, yeah. Yeah, and often they do take it not for that, but to help the pain,
Yes.
right?
And it
So,
works, so they're
yeah,
happy. It
yeah,
works,
yeah,
but
exactly.
it's still not curing them.
No, no, no. And I again, this is not my field of expertise, but I've understood that there's also an increase cancer rate with the use of some of these birth controls, or is that true? Like
So
it's.
there have been many studies on
Mhm,
cancer and the birth control pill, and particularly of concern is breast cancer.
mhm.
And there have been massive studies, and some have shown absolutely no increase, and others have shown a slight increase in risk. So
Okay.
basically, the counseling is there may be a slight increase in risk in the long
Mhm,
run.
mhm,
We don't know more past that, but I think there are a lot of other factors that are sort of missed when you're put on synthetic hormones. It
mhm,
can give you all sorts of side effects and issues and problems that are sort of swept under the carpet.
mhm,
And a lot of women don't tolerate them very well.
What would your life be like if you were pain free? If you were one of the millions who suffer from chronic pain, the thought of just one day without it may seem impossible. This is often because conventional medicine tends to fall short in the treatment of pain, opting to prescribe pills or recommend surgery rather than getting to the root cause of the problem. But if you are suffering with emotional or physical pain, there is hope. Join the founder and CEO of Bowen College, Manon Bolliger, live online for your body-mind reboot. Learn how to listen to your symptoms and get to the root cause of your pain. Plus, be trained in basic Bowen therapy moves so that you can reboot your body for optimal health. You don't have to live in pain. You can heal. Stop the pain pill cycle by visiting www.yourbodymindreboot.com to learn more and to register.
So
mhm. Just
there,
such as what? Just.
oh, a lot of women will suffer from mood changes,
Mhm,
sometimes a lot of depression,
mhm,
from headaches, migraines, not feeling well. Um, Weight gain, with the lower and lower dose pills, it's not as bad as it used to be because the birth
Mhm.
control pill is literally 10 times less the dose than it used to be when it first came out in around
Right.
1960. So it has
Mhm.
improved from many points of
Mhm.
view. It's not
Mhm.
as bad as it used to be. But there seem to be a lot more side effects these days, or at least maybe women are complaining more. But
Mhm.
I'm wondering whether there isn't more interaction with chemicals in the environment, and that's why I
Right.
hear more complaints. And I suspect that that's part of it.
Mhm. Well, it's almost like there's a toxic load that we're all
Mhm.
carrying. And then
Yes,
you add one more thing. It could be the thing, but it could
yes,
be the ensemble of, terrible stuff. Like,
absolutely.
it's unbelievable how much toxicity we're being exposed to.
And we're all genetically different in terms of how we
Mhm.
manage that toxicity. So the people
Mhm.
who have poorer detoxification in their liver, which
Mhm.
is a genetic thing, will
Yeah.
be the first ones to have the symptoms, the canaries in the coal mine.
Right.
So those are the people who often will tell you, I react to every medication I take. I get side effects with the lowest doses.
Mhm.
I can't tolerate that, or the people with the chemical sensitivities. They used to be thought as people who complain a lot and don't really have a
Mhm.
problem or making up their issues. But these are the people who don't metabolize drugs well
Right.
and don't metabolize toxins well because it's the same metabolic pathways.
Exactly. Hmm. Yeah,
And
I
we're
am.
seeing more and more of those people.
Yeah. I'm definitely one of those.
Okay.
Yeah, I used to think, oh, come on, I'm a hypochondriac, or but it's not that. It's just I can tell ahead the reactions almost, and now I'm much better than I was, but I have really done a lot to work with my immune system,
Mhm.
and with homeopathy, which has made me much more tolerant, so. Um, yeah, it's like, but it was very hard when everything seems to be an irritant. I'd have always
Yeah,
like scratchy eyes and sniffing nose and all of that for nothing. So
yeah,
yeah, it's
yeah.
interesting. And I did have the pleasure of taking once an aspirin and reacted to it. It's like this
Mhm.
cannot be true, but it is, so anyway, I guess that's why I went into likely I went into naturopathic care because I had to figure out something natural
Mhm.
that would work, though you can react to trees and all kinds of things
That's true.
naturally, right? So, but
Mhm.
it's really about looking after the immune system, which is not something that in typical medical care they do. That's,
Mhm.
so anyway, what about I was thinking I'm hearing so many pelvic hair is needed. Like I don't know if, on Instagram and I follow, I don't write much in there, but it's like
Mhm.
it seems to be so many women now are having these they need to go to see a specialist for this. They're having pain and in young ages, like in their 30s, it seems like so much more than before. Is that just a one-off experience that I'm looking at, or is there something going on there?
Are you speaking particularly about pelvic pain, menstrual pain, or?
It's actually with pregnancy. A lot of like, low back. I mean, there's always been low back pain and there's, adjustments to some women, but it seems like this whole idea of work, the need to work with the pelvic floor has really increased in consciousness. Anyway.
I think we've recognized over the years that a lot of unexplained pelvic pain can be due to muscular um, asymmetry, and
Hmm.
that pelvic floor physiotherapy can be extremely helpful for these pelvic floor
Hmm.
problems. And I think it's the recognition is there that it can be helpful in disorders that we didn't recognize before.
Right.
So
That makes sense. It's a
mhm.
good thing. I guess the more you bring consciousness to what's not feeling right, the more therapies or ways come to your,
Mhm.
you know, in your line of vision, I guess. You start to see them because you're looking for help in that
Yes.
area. Yeah. Um, Now, what else do I want to ask about your practice? Well, why don't you maybe share one of the more exciting aspects of what you do and in which ways you feel you make that difference for people?
Well, I guess what I'll talk about is the writing of my book because that's been pretty
Okay.
life-changing for me.
Yes.
And I'll talk about how it all started. So about 3 years ago, my daughter graduated from medical school, and she had her birthday shortly thereafter. She was older than her classmates. She had done 2 degrees before, and she had turned 31. And she asked for her birthday present if I would pay for her to freeze her eggs. And I was taken aback. Now, I get that request in my office from patients, but I didn't
Yeah.
expect it from my daughter because I
No.
sort of felt that she was still young enough that she didn't really have to think about it. But she's a person who thinks ahead, smartly so. And my first reaction was, yes, of course, I want grandchildren. If I have to pay for freezing your eggs, I'll do that. But then I thought about it, and she was starting a residency at the fifth biggest trauma center in the US in emergency medicine. And I thought, oh my God, the next few years are going to be hell for her. And you don't want to freeze your eggs when you're stressed and tired. That was my first thought. And, intuitively, I knew stressed, tired eggs are not going to be healthy eggs or good eggs. And that's a lot to do with my functional medicine type of thinking. And I've also been very interested in longevity medicine for a long time for my own health and for my patients' health
Mhm.
as well. And that's all about lifestyle too, as
Right.
well. So what I started thinking was, I have all these patients who are delaying pregnancy and they want to be able to do something in the meantime. And many of them are interested in freezing their eggs. And I know that lifestyle is important, but I know also that my colleagues don't talk about it in conventional medicine. So I started researching with my daughter in mind, what
Mhm.
what can I show has proof? What lifestyle changes have proof behind them that they improve fertility? So I started looking, at diet, at the literature on diet, at the literature on exercise, on sleep, on stress reduction, and the
Mhm.
big one is on reducing chemicals in your environment, and
Mhm.
started researching papers to show that improving these things would improve your fertility for a woman or for a man, for both.
Mhm.
And there actually is a lot of literature to support this. Now, maybe not those huge mega studies that are double blind,
Mhm. Mhm.
sort of randomized controlled
Right.
trials. No, there's smaller trials because when it comes to non-pharmaceutical, non-surgical medicine, there's less money to support that kind of
Of course.
research. But there is research in that, and
Mhm.
and there actually, I was surprised to learn how much there was. And
Mhm.
this really made me happy because I thought this is what people need to know.
Mhm.
Certainly when they're preparing for pregnancy in the long term, if they're wanting to freeze their eggs, or if they have conditions like polycystic ovarian syndrome, because lifestyle management really, you can turn very irregular periods into regular periods by improving the diet, improving exercise, making sure their vitamin D and vitamin B12 are
Mhm.
optimal, and giving them omega 3s if their HDL is low. If you do all these things,
Mhm.
your periods start normalizing,
Mhm.
weight is lost more easily. It just,
Mhm.
everything comes together. And having seen patients through this, and I've had more pregnancies in my practice in the last year than I've
Mhm.
had for years before that, because I've started really focusing on that with
Right. Yeah.
patients.
Yeah.
So I ended up doing that research, and then I decided to start a course for some of my patients who I knew were attempting pregnancy. And I did like
Mhm.
a monthly webinar
Mhm.
series.
Mhm.
And at the end of 4 months, I finished the first round of webinars, and I thought, wow, this really needs to be a book. So that was
Mhm.
my next project, was to
Wow.
turn it
Great.
into a book.
Yeah.
And basically, it's been 3 years of my life, but I finally launched my book on June
Oh,
20th, and it's now on Amazon.
oh, what is it called?
It is called, it's right behind me.
Yeah.
It's
Yeah.
called Optimize Your Fertility Naturally.
Oh,
And it's basically about all those things that I talked to you about, as well as a few different things like other traditional medicines like Ayurvedic medicine
mhm,
and traditional Chinese medicine and what they
yeah,
do about fertility, and newer things like platelet rich plasma in rejuvenating ovaries,
mhm,
newer things in immunology and pregnancy, because I
okay.
learned a lot,
Yeah.
researching this book. And I thought people have to know about this because it's generally not talked about in
No.
fertility medicine. In our way of dealing with things, like the average gynecologist, if somebody's complaining about infertility, will check if your tubes are open, if you're ovulating, if the sperm count's okay. And then if those are all okay, you sort of send them for IVF. They're usually told you have unexplained infertility, you need IVF. And
Mhm,
there's nothing happening in between, like,
mhm,
what's your
mhm.
general health like? How do you eat? Are you under
Yeah,
stress? That's completely ignored.
yeah,
So I really thought there was room for this kind of education somewhere
definitely. Yeah.
between, regular care and IVF care.
Hmm, hmm. And what have you found to be uh, um the biggest, I don't know why my brain's going in French today. It's like I'm translating. It's like, it really, I'm not sure what's going on, but we'll go with it. Um, but what is it, the things that you see most often, let's say in your last year, that women are not getting right, or that surprisingly, like they're saying, "Oh, I didn't realize that,
I think
spraying."
that they don't realize how many things can affect fertility.
Uh-huh.
It's been dealt with like a plumbing problem. If the
Right.
valves are open, it should work, right?
Right.
Whereas everything that you do in your life affects your health and your fertility. It affects
Yeah.
both.
Yeah.
So, stress being a major one, of course.
Mhm.
We're all under stress. Our lives are very stressful. What's happening in the world is very stressful.
Mhm.
That's part of life. And if it's not well managed, it,
Yeah.
it, it affects your health in terrible ways and it'll affect your fertility.
Hmm.
Um, and,
Yeah.
and that's not really well recognized generally. But
Mhm.
you have to really look at everything. If you're eating junk food 4 times a week,
Mhm.
that's not great for your
No.
fertility.
No.
And people think they can sort of get away with it and don't think it's really important.
Right. Yeah, and I think too, there's like, drugs that are almost advertised as safe. Oh, you can just take
Wow.
Tylenol, you can take this, you can take, or spray the house with Febreze or
Right. And that's the other thing. So many more young people are on medications these days than
yeah.
they used to be in the past. So antidepressants being a huge one. And they're sort of told, well, it's pretty safe, you know. But I think that those drugs do a lot more. I mean, we're seeing a lot more autism, a lot more anxiety, a lot more ADHD. It's connected with the way we live,
Of course. Yeah.
and it may be hard to find the actual root cause because it's probably multifactorial for a lot
Mhm,
of those
mhm,
things.
mhm.
But the drugs that we take are, important contributors.
Yeah, no, for sure. All right. Well, our time is up, and I just want, how can people get hold of you? Well, the book on Amazon, but
Yeah.
do you still see people, and
Yes.
yeah,
So I
and where are
still
you
have an
located?
office practice in Ottawa.
Okay. Okay.
But I'm past retirement age. So it's something I'm sort of trying to develop a career more as a writer and an author,
Right.
as a speaker and an author now. So I will be looking at retiring
Hmm.
I haven't set a date, I'm looking
Yeah.
at that slowly. But in the meantime, I do want to write more and speak more. I do have a
Hmm.
website. It's Dr. Marina OBGYN. That's drmarinaobgyn.com, where I have information about my book. I write a weekly blog on fertility, so you can sign
Okay.
up for the blog. And I'm now in the process of talking more about my book now that it's finally out. So I'm trying to appear on podcasts and on radio and so forth. I've got interviews set up. So I will be in people's faces a bit more
Very
if
good.
I'm successful, and people will hopefully hear about what I'm doing and can definitely get in touch with me through the website. I'm
Okay.
also on Instagram,
Okay.
dr.marina.obgyn. So you can follow me on Instagram.
All right. Well, thank you very much for giving us some of your time and your expertise.
Well, thank you so much. It's been lots of fun.
Thank you for joining us at the Healers Café. If you haven't already done so, please like, comment, and subscribe with notifications on, as I post a new podcast every Wednesday with tons of useful information and tips for natural healing that you won't want to miss.